Okay, this chapter is going to be on infection control and concepts. This is a really quick overview PowerPoint. You're going to want to read the chapter to make sure you fully understand. But here's your objectives. You need to list, explain, and define, and list and describe and discuss and contrast. So your key terms, boy, that printed small. So all your key terms that you're going to have to know and more. And microorganisms can be bacteria, rickettsia, viruses, fungi, prions, and protozoas. And you'll need to look up and be able to define what each one of those are. And so the cycle infection, this is opportunist infections. So if we look at infectious organisms, then it goes to the reservoir, to the port of entry, to the susceptible host, to the port of entry, to the transmission of the disease. And you'll see this in your book, and it explains it a little bit deeper. So infectious organisms, microorganisms capable of causing disease are called pathogens or pathogenic organisms. Virulence factors distinguish pathogens from non-pathogenic organisms and normal flora. So in Table 8.1 in your book lists a bunch of different pathogens that we are susceptible to. So the reservoir infection, so a place where pathogens can thrive in significant numbers to pose a threat. They must have moisture, nutrients, and suitable temperature. May be human or non-human, so it could be food, water, or other animals. The port of exit, so any route through which blood and bodily fluids, excretions, or secretions leave the body, so it could be the GI tract, an open wound, or the respiratory tract. And the susceptible host, patients are often hosts because of reduced immunity. So when you get an infection in the hospital, it's called nosocomial, and healthcare workers are also at risk as we're exposed to blood and other bodily fluids. So the port of entry, so the route in which the microorganism gains access to the susceptible host. So like we said, it could be respiratory, urinary, GI, an open wound, or a break in the skin. So if you have a cut on your hand, make sure you have gloves on all the time. If you have a cut on your arm, make sure it's covered up. And I usually put like Tegaderm over it so it has a seal so that no organisms can get into your open wound or broken skin. So mucous membranes, so of your eyes, nose, or mouth. So don't touch a patient and then touch your face. And then, or don't bite your nails. Those of you that bite your nails, you need to stop immediately. And then through the bloodstream, of course. So transmission of disease. Most direct way to break the cycle of infection is to prevent the transmission of the infection organism from the reservoir or susceptible host. There's 6 routes of transmission. There's direct contact, fomites, vectors, vehicles, airborne, and droplet. So direct contact, infected person must touch susceptible host, requires a pathogen to be placed in direct contact with the susceptible tissue. So some examples of that are syphilis, HIV, and staph infections. Fomites, so an object that has been in contact with a pathogenic organism. So that's through contaminated gloves, the X-ray or MRI table, and positioning sponges are just a reservoir. Yeesh. Make sure you clean them. So vectors are an arthropod in whose body an infectious organism develops or multiplies, becoming infected to a new host. So transmission occurs when an infected insect bites the host. For example, we have mosquitoes that transmit malaria and ticks that transmit Lyme's disease. Vehicles, any medium to transport organisms, so it could be food, water, drugs, blood, so that's a vehicle. It's how it transports. Think of a car transporting you, so a vehicle for organisms is the same. Airborne, all right, occurs from dust that contains spores or by means of droplet nuclei. So droplet nuclei are particles of evaporated droplets containing the microorganisms, measuring 5 microns, so micrometers and Anyway, so which is is 0.001 millimeters or smaller. So it's very, very small, and it can become airborne and be suspended within the air for long periods of time. So if a person's on airborne precautions at the hospital, make sure that they have a mask on when you're transporting them and that you have a mask on while you're transporting them. Some examples are TB. Varicella is also transmitted by direct contact also, so 2 ways. Droplet contamination occurs when infectious individual coughs, sneezes, speaks. When you speak, you spit, and whatever is on your spit becomes airborne. Singing in the vicinity of a susceptible host involves contact of the mucous membranes of the eyes, nose, mouth of a host with large droplets greater than 5 microns and contains microorganisms. Droplets do not travel far, so these are heavier and they're 3 feet or less. So examples are influenza, meningitis, pertussis. I actually had pertussis a few years ago. Holy Moses, I was really sick, lost my voice completely. And then streptococcal pneumonia, which we will cover in your pathology class. So body's defense against infection. So there's the natural resistance provided by mechanical barriers, by intact skin and mucous membranes. Acquired immunity, so long-term, occurs when individuals develop antibodies to a particular organism as a result of either infection or immunization, and that's what we are doing with you, trying to keep you protected. There's passive immunity, occurs following an infection of performed antibodies to a particular infection. So that is your lecture. Real quick, easy on infection control. We do use personal protective equipment. We have universal precautions. When we talk about universal precautions, we're talking about what kind of precautions would we do for every single patient, infected or not. So hand washing is really big. Make sure you wash your hands when you enter and exit a room. Make sure you wear gloves. And if the patient has anything oozy or drippy, you're going to put on a gown. If the patient has a nasty cough, put on a mask. Put the patient on the mask too, to protect yourself. So do what you need to do to protect yourself so that you don't get any of these horrible, nasty diseases.